Hi, this is Dr. Vikas Gowd, your smile dentist. Today, we're going to discuss about tooth decay and cavities. In tooth decay and cavities, do stay so that you know about when do you have to take these cavities seriously. You will get to know about how these cavities are formed, when do you have to take these cavities seriously, and the most important, how do you identify these cavities, whether you have these cavities or not. Because if you can identify these cavities right there when it is starting, then you can prevent further damage to your teeth and protect your teeth for life. Remember, teeth that are there in your mouth, they're supposed to last a lifetime. A lot of people think that teeth, they get damaged, they go away, and by the time they are in their old age, they will definitely have to replace this teeth. This is not like that. When you have teeth, like your all other organs in your body, like your heart, liver, kidneys, these teeth are also organs in your body, and they are supposed to last a lifetime. So taking care of these teeth, these pearls in your mouth, in your smile, is your responsibility. You are in charge to take care of your teeth. Well, the first thing, how do you identify cavities? Well, if you have to identify cavities, first thing to see is when you brush and after you finish your brushing, if these black spots on your teeth don't go away, you think they are food particles that they are not able to remove, then this is early signs of cavities. Number two, food getting stuck between your teeth constantly, which you have to clean up every now and then. These are another early signs of cavities. If you are having sensitivity in your teeth, and because of every time you have food cold or you eat sweet and you have sensitivity in your teeth, that is another sign of having cavities. So visiting your dentist now itself can solve this problem, where you can protect your teeth, take care of your cavities then and there. You can protect your teeth, and these teeth that can last a lifetime. Number two, a lot of times patients, when they come to us, is at a time when they come when there is pain. They come to us with pain and say, Doc, please do something. We have pain in our teeth. This is a time that most patients come to us. Well, if you have pain in your teeth, that means the cavity or the decay has gone from your outermost layer, which is your enamel. It has gone to your innermost layer, which is your dentine, where you could have sensitivity. And now it has come to the innermost layer below that, which is your pulp or your root canal. That means the innermost layer of your tooth, which has the root canal, which has the nerves and blood vessels, is now infected, and this cavity cannot be treated as a simple cavity. It has to be treated with a root canal treatment. Well, this is a time that normally a lot of years back these teeth used to be removed, but today we can save this teeth by doing something called a root canal treatment. Well, sometimes a lot of patients, they ignore the pain, they take some painkillers, they take some in-home medication, home remedies, and they avoid the pain, they postpone it. And by the time they come to us, the tooth is pretty damaged. The tooth is either broken or there is a lot of damage of the tooth structure, and it becomes very, very challenging for us to replace or repair this tooth. Sometimes, even if the tooth is broken and if it is still above the gum level, we can still treat them by doing something called root canal treatment along with a post and core and treat the tooth. We will keep a cap or a crown on top by taking the support of the root by doing a post and core treatment, and this can still be treated. A lot of times when this cavity goes into your pulp or your root canal, there is pus that start accumulating or an abscess that accumulates at the end of the roots. That is when you have severe pain while you eat, when you drink water or anything. That is a time that patients come to us. Well, we normally evaluate the situation based on an x-ray, and we will be able to tell the patient whether this tooth can be saved or it is probably better to remove this tooth and replace it with an implant or a bridge. So Don't ignore cavities. Don't ignore the early signs of cavities. If there is a spot, if there is food getting accumulated, if there is sensitivity of your teeth, don't ignore these early signs. Visit your dentist. Protect your teeth because these are teeth that are supposed to last a lifetime. If you find this information useful, do subscribe to our channel, share it with people whom you think this is going to be useful, and don't forget to follow up on our next video where we're going to talk about the treatments that we do to these cavities.